Mr. Vikram Nair.
Question 19, sir.
In 2025, for walk-in patients, the median and 95th percentile doctor consultation waiting times were 8 minutes and 72 minutes respectively. However, MOH does not track waiting times by peak versus off-peak hours, but it is likely that 95th percentile waiting times happen during peak hours. That is why it's important for us to operate on an appointment basis as much as possible to optimize capacity and patient waiting times and to spread out patient arrivals across the day. That said, we always schedule fewer appointments than full capacity to accommodate walk-in patients with acute medical needs.
Mr. Nair.
I thank the Minister of State for the answer, and I think it's an improvement from the last time this question was asked 2 years ago, which is, I think, what I have here is 17 minutes and 164 minutes. So there is improvement, but I think 1.5 hours waiting time is still quite long, and I was wondering whether there are any plans to maybe introduce more capacity for polyclinics. Thank you.
SMS Koh.
So I thank the member for his question. I think that is a question that many patients also ask. But let me explain what exactly happens in a clinic, because it is not such a straightforward issue as trying to stick to increased capacity. Because in the midst of increasing capacity, we also want to optimize the use of that capacity. We could actually leave a lot of empty slots just in case there are walk-in patients, but that means there will be a lot of time wasted that will not be used if there are no walk-in patients. And in the sense, there will always be a trade-off there. But when we do schedule appointments, we hope that we can stick to the time. When the patient arrives, we then serve the patient within the allocated time. But as you can imagine, it's often not so straightforward to determine ahead of time how that conversation and that consultation with each particular patient will go. Even if you allocate, say, 15 minutes for what we think is a reasonable consultation time, sometimes the patient that comes in that time slot may have a very complex issue, multiple medical problems that takes a far longer conversation and examination to complete, in which case it may take half an hour and therefore it eats into the next patient's waiting consultation time. And in a busy clinic, sometimes such long conversations on a particular day, you may have quite a few complicated patients that come in sequentially. That means that there will be, therefore, a snowballing effect. And patients who are seen at the later part of the session, of the morning session or afternoon session, will therefore end up experiencing a longer waiting time, even though they've been given a scheduled appointment. So there are quite a lot of complicated dynamics happening in a clinic on a day-to-day basis, and it's very hard to predict ahead of time how each day will pan out. But what we're trying to do is to stick as much as possible to more scheduled appointments, so we minimize that variance as far as we can. And we see that for a scheduled appointment, the waiting time, on average, median waiting time for in 2025 for a scheduled appointment is about 10 minutes. And so you can see that the medical staff tries as far as they can to complete a consultation and conversation within an allocated time frame, so you minimize the snowballing effect. But the 95th percentile waiting time in 2025 for a scheduled appointment can go as high as 52 minutes. Again, like I said, if you are towards the end of that morning session where the prior patients before you have longer conversations, that snowballs into a much more longer waiting time for those at the end of the session. But this is what a healthcare clinic usually goes through, and we will try our very best to resource with more consultation slots to actually meet all those demands. What the clinic tries to do is that for those who turns up in a walk-in manner and for which the staff triage that this is actually not something that is an emergency or extremely urgent, they will try to schedule the next day's appointment for this resident so that he or she can come back the following day without having to be subjected to a long waiting time as a sudden walk-in patient. I hope that kind of gives you a sense of how complicated it is, but how the efforts are still being made to try and reduce waiting time.
Mr. Pritam Singh.
Thank you, Speaker. Empathetic to the arguments of efficiency and ensuring that patients can see polyclinic doctor consultation as quickly as possible. I understand the SMS mentioned it's important to try and make an appointment so that your waiting time is within a certain window or within a certain period. But can I ask the SMS, is the ministry taking note of how many people are actually walking in, vis-a-vis making scheduled appointments. And I ask this in the context of a super-aged society because there's also the added problem of difficulty in making appointments for certain individuals, especially those who live alone, for example. So over the longer term, does the ministry have a sort of a data point for us to understand whether there are individuals who are making appointments, or is that really going to be an extant problem that the healthcare system has to deal with and has to accept?
SMS Koh.
So I thank the member for his question. I don't have the numbers for the percentage of walk-in versus scheduled appointments, but I think in general, most patients who do not have pressing issues will try to fix an appointment because they want certainty of time and also reduce their waiting time. But healthcare being the way it is, there will always be sudden onset of discomfort and unwellness that they will prompt a walk-in appointment. But that is why we don't work just based on polyclinic resources alone, and we have resourced many of our GP clinics with CHARS so that patients have an additional option to go to a nearby GP clinic and get subsidized treatment at the GP clinics as well, even if there's a walk-in situation. So it is about actually working with the entire resource of what we have in the entire healthcare ecosystem and not just focusing on just polyclinics per se. And I think over time, as we improve on our Healthier SG enrollment, there will be better relationship between the patient and their enrolled GP, so that that stronger nexus and better understanding between the patient and the GP will hopefully also spread the load out for each individual patient to the GP clinics, where they also have more easy accessible to care nearer their home as well.